Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here on another Monday night at 9 p.m. Eastern Standard Time for one of our live Q&A questions and answer sessions. Sorry. This is a chance for you guys to put any questions that you have for me into the chat, and I will answer them live, as well as I will get a chance to answer any of the questions that you have submitted onto the videos this week. For any of you who joined me last week, so sorry about the technical difficulties. All of the sudden, there was no internet service. So we had to kind of cut things short. Also, for any of you who have been here for the last couple of weeks, I am now in my third week of COVID jail, aka I've had COVID symptoms or COVID infection for the last 3 weeks. So if I sound a little hoarse or I cough a little bit, that's what's going on. Please remember, you can follow us over on Facebook, Instagram, and Twitter for additional content. We will link those into the description. And please remember to like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator, so I would really appreciate it. You can also make sure you get notified by hitting the notification bell of any new videos that we have coming out. Due to COVID, we have not been able to film, but we will hopefully be filming this upcoming weekend, and we have some exciting videos that we have prepared for you. So you will hopefully be getting some new content again next week. So if any of you guys have any questions, please feel free to put them into the chat. Otherwise, I am going to go ahead and get started with some of the questions that you guys had on the videos. So, hi, Doc. This is on my baby aspirin video. Hi, Doc. I was taking 80 milligrams of baby aspirin during my first trimester, and now I'm taking 100 milligrams as per my OBGYN's prescription. Is 100 milligrams okay? So this is a great place for us to get started tonight. So baby aspirin is a blood thinner. So it is used during pregnancy to help with preeclampsia. If you have any symptoms of preeclampsia, or if you have any risk factors for preeclampsia, your doctor is going to recommend that you start using baby aspirin. The idea behind it is that it helps to thin the blood, which may help with blood pressure and other complications of preeclampsia. The dose for baby aspirin is exactly as it sounds, meaning that it's baby aspirin. Baby aspirin is usually 81 milligrams, usually comes in a chewable tablet. Aspirin is actually available over the counter as a pain medication, as a fever medication, and it's usually dosed for adults at around 300 milligrams. That is not safe for pregnancy. Let me just repeat that. Adult aspirin is not safe for pregnancy, and that is not indicated. Most physicians should be telling you to use baby aspirin or aspirin that is 81 milligrams in strength. Now, this particular viewer said that they were told to take 100 milligrams. And so, of course, this may be confusing to anybody who's kind of like, but wait a second, it's usually the 81 milligrams. Most medication is weight-based, okay? So when you are a certain weight, certain medications will work well for you. As you get larger, you may need increased medication. Great examples are for thyroid medication or diabetes medications. Both of these medications are very weight-based in their dosing. So we have to check weight as we're dosing somebody with them. So it is possible that this person's healthcare provider is asking them to increase the milligrams of the aspirin to accommodate increased weight for their pregnancy. What I will tell you is you want to double check that with your healthcare provider and ask why have they asked you to increase it. Know the reason behind the increase instead of just doing it. Additionally, you can also double check that dosing with your local pharmacist if you're concerned. I would tell this viewer, yes, you should do it if that's what your OB is prescribing to you. It's not so big of a difference that I think it's unsafe, but you definitely want to clarify in case you're concerned that it might have been like a misunderstanding. For anyone else seeing something like that, no, you would not do that unless directed by your healthcare provider. And for anyone who's been told to take baby aspirin, yes, it's extremely effective in helping with preeclampsia. So I definitely am for it. So We're going to go on to bleeding. I get a lot of questions about bleeding every week. So, first question was, this is my first baby. I've taken 5 pregnancy tests since I was supposed to have my period, and along with a blood test, they were all positive. Now I'm 5 weeks and 6 days pregnant, and I've been experiencing some very light liquid brownish discharge only when I wipe. I'm also having very mild discomfort, even lighter than when I'm having my period. But I'm worried since this is my first pregnancy and I'm not supposed to see the doctor until next week. Is there this something to worry about? What should I do? Another question I got was, in the beginning stages, can someone still have a period and be pregnant? So these two questions kind of pair up perfectly for talking about bleeding, especially in the first trimester. So bleeding during the first trimester of pregnancy is extremely common. Unfortunately, it can be very scary because bleeding is associated with miscarriage. But bleeding does not always mean that you are having a miscarriage. So, for starters, you can still have a period during your first trimester and have a healthy pregnancy. Sometimes your body's just kicking into place. It doesn't really know quite what's going on. And so you may shed some of your uterine lining and have a regular menstrual flow and still have a healthy pregnancy. And honestly, doesn't this make sense? I mean, how many of us have seen those shows? Found out when I was 9 months pregnant, and I didn't even know I was pregnant. What do they always say? I kept getting my period. And so that's exactly explaining it. Some people will continue to bleed and still be pregnant and have a healthy baby. Now, brown is a sign of old blood. So this is a bleeding, something that's been bleeding that has resolved. And this can happen for a variety of reasons. For starters, when you have sex, you can bleed during pregnancy. The hormones for pregnancy thin out and they dry out the vaginal tissue. So you have sex and you can end up bleeding. You can also bleed due to infection. You can bleed from a hemorrhoid and think that it is actual vaginal blood. So it's important to also understand the colors of bleeding. We have a video on that. Brown is usually old blood, so the bleeding has already happened. Bright red blood is the blood we get the most worried about because that's an active bleeding system. Now, unfortunately, a lot of women early in pregnancy are not able to get uh, an appointment with their provider until they have reached 6-7 weeks of pregnancy. If you think you are bleeding and you're having a complication, your best bet is to go to the emergency room. That way you can get a full checkup. And we actually have a video on going to the emergency room when you've been bleeding, and it lets you know what they should be looking for. If you were to use a home pregnancy test, okay, the home pregnancy test, you pee on a stick and it's checking for human chorionic gonadotropin, HCG. And HCG, it's just going to basically give you a yes or a no. So as long as there's a little bit of HCG in your system, you're going to get a positive pregnancy test. However, unfortunately, that does not indicate whether the pregnancy is going well or whether you might be having a miscarriage, which is why getting checked out is so important. In order to determine by HCG level whether the pregnancy is going okay, you need to get blood work. So this person indicated that they got blood work. And one of the things I can tell you is the only way to determine that the pregnancy is going well is you get a blood test and 3 days later you get another blood test. And that level should be rising. And if it is not rising at a certain rate, then that usually means something's going wrong with the pregnancy. That associated with some spotting could be an indication of a miscarriage. So I would definitely go ahead and get checked out on that. All right. Any of you guys who are joining me, feel free to put your questions into the chat. So I am about 6 weeks pregnant and my breast milk is drying up. Is there any way to increase it again? So this is a question that came in on my video, Breastfeeding While Pregnant. So a lot of women who are breastfeeding when they become pregnant want to continue to breastfeed. And believe it or not, that's actually considered a very safe practice. There's very few women who have to stop breastfeeding just because they became pregnant. However, the thing is that if you do get pregnant, your breast milk may dry up because the hormones that are needed to maintain a healthy pregnancy often are not very supportive of breastfeeding, okay, or breast milk production. So, unfortunately, even with a lot of stimulation and stuff like that, the breast milk can dry up. Now, the thing is, the question was, is there anything I can do in order to stimulate milk? Now, I'm not going to say that you're not going to find stuff out there on the internet that would tell you how to increase breast milk while you are pregnant. I am going to tell you I would not recommend it as a lactation consultant. So, when somebody comes to me and asks how to increase their breast milk, I have a couple of videos on it. For starters, I have a whole video on like herbal supplements, right? If you're pregnant, you cannot use any of those herbal supplements. So anybody who's postpartum and is trying to increase their milk supply, please check it out. That's a great video. Those are a lot of herbs. But just like you can't use herbs to dry up your milk, you can't use herbs to increase your milk supply when you're pregnant because those herbal supplements are not tested on babies. So there's no way for you to know if that's safe for your unborn baby. Now, second of all, what are some of the other things that you can do? Well, you can stimulate your breast. You can increase pumping. So increase pumping. In theory, it sounds okay, but the reason why they will tell you to stop breastfeeding is this. The hormone that sends milk out, the milk ejection hormone, is oxytocin. Oxytocin is also the love hormone. Now, oxytocin causes the milk to eject, but it also causes the contractions of the uterus. Oxytocin is the natural name for Pitocin. Pitocin is the drug that we often hear about being used in the induction of labor. And its job is to contract the uterus. And so that's also the hormone that you will have released when you have an orgasm, which causes your uterus to contract during an orgasm. So that contraction pattern, it causes a uterine irritability. Now, most safe, healthy pregnancies are going to be just fine. Babies do just fine with orgasms. They do just fine with breastfeeding. There's not an issue. However, there are some pregnancies where excessive uterine irritability could become an issue. It could become a risk factor. So if you're trying to increase your milk supply by pumping, and in basically stimulating a lot of oxytocin in your body, that could cause a lot of uterine irritability, and that might end up being a problem. So this is why I say, I don't recommend you trying to increase it at all. If your body is drying up your breast milk supply, I would suggest you start looking into supplementing your baby and keeping your body, like follow your body's cues for your pregnancy. All right. So, on kind of going in the same area, I had a question on my drying up breast milk video, which said, my daughter is 15 and I still have milk in my breast. So, on the opposite end, some women will have an oversupply. And then sometimes the milk lasts for a long, long time. So, when you do have breast milk that's left over, what you need to do is you need to try to use some of the tips on the drying up breast milk video. And some of that includes using ice around the clock, cabbage leaves. Cabbage leaves have been used for hundreds of years and are very effective. You can also use peppermint oil and peppermint tea. That's extremely effective. So these are all really good things to help dry up your milk. But if you're talking about somebody who's had a baby 15 years ago, at this point in time, you need to seek medical help. There are other causes of producing breast milk. And breast milk is usually predominantly produced when we have high levels of prolactin, which is a hormone. It's the milk-making hormone. And when there's high levels of prolactin in our body, that signals our body to make milk. And just so you guys know, if a man has too high of prolactin levels, he can actually produce milk as well. So if you have are you producing breast milk after 15 years, you need to go and have a blood test done to check your prolactin levels. If your prolactin is high, they're going to look at your diet, they're going to look at the medications you take and any vitamin supplements to see if there's anything there that might be causing the high prolactin. If they can't find it there, they are going to do an MRI. MRI is a scan of the brain, and what they're looking for is the pituitary gland, which is basically kind of center of your brain behind your eyes. And that gland can sometimes have what's called a prolactinoma. And a prolactinoma is basically a little teeny tiny tumor. It is not cancer, it is benign, but that little tumor causes excess prolactin. If left untreated, it can lead to a lot of difficulties. So they usually try to take it out. And it's a pretty standard like surgery. It's done a lot nowadays, and it can really help. So that's kind of what I would say is you need to go and get checked out by your healthcare provider. For those of you who are joining me, welcome, welcome. I'm Dr. Samantha, the maternity mentor. I am on my third week of like cold symptoms from COVID. So if I sound a little funny, that's what's going on. Please feel free to put your questions into the chat. All right. I had a great question on formula feeding. It said, "Hello, any suggestions regarding which formula would be most suitable for a baby prone to developing wind in their tummy? We are based in the UK." So this is a great question. Many of you guys know that I am a lactation consultant, but I'm also very pro formula. I think that feeding is best left to families and their choices. So formula, we have lots of different options for formula. When you're talking about a lot of gas and a lot of like upset stomach and colic, the first thing I would tell you is you need to actually make sure you're feeding the baby right and you're burping the baby right. Okay, so we have a video on the best way to bottle feed. It's basically paced bottle feeding, and you can check that out. But to be very honest, the start of gas in the stomach is actually the nipple you're using, the bottle you're using, and how fast a baby is feeding. We're so used to feeding babies like this, and that baby that's feeding like this is just sucking down air. And then the other thing is when you're burping a baby, so many babies are just like it's like tap tap, and you can't even hear anybody doing anything. You need to really give them a nice good pat so that they can actually like really get a good burp out, like, or many burps out. Now from there, what you want to do is you actually want to make sure that you are then looking at what type of formula you're eating or feeding the baby. So standard formula is usually cow's milk based. It oftentimes the cause of some discomfort is the fact that a baby is lactose intolerant. You'll find that a lot of providers want to move you straight into soy. What I am going to tell you about soy is that soy can be constipating. Okay. So, a couple things about soy formulas. Number one, constipation is a real thing. And a lot of times babies don't need soy formula and they simply need lactose free. So you want to ask that question before you just go running down that route. The other thing is nowadays you have a lot of gentle formulas. So you have like the gentler formulas, and then you even have the hypoallergenic. And basically the difference between the three is that they start to break down some of the proteins, so it's easier to digest. Soy formula, it's a plant-based thing. You want to be very careful about where that source of soy is coming from. A lot of people don't realize, but soy is high in estrogen. So you're talking about some hormonal issues there. There's a lot of European formulas that are goat's milk based. You want to make sure that it's been monitored by the European agencies that like look over formula. There's actually one of the videos that I'm going to be putting out is a comparison between United States formulas and European formulas, because a lot of United States citizens will ship in European formulas. And believe it or not, guys, there are some great things about European formulas that we don't have here in the States, but there are also some really good things that we have in the States that they don't have. Like our two authorities don't actually match. So you really want to do your best to it's a lot of research. The last thing I'm going to tell you is You can't do any like rice-based formulas, nut-based formulas. Those are not a real thing. They don't provide what is needed, at least not any that I'm familiar with. And you want to make sure the formula is for a newborn. If you have a 0 to 3 month old, that is a newborn. It needs to be a 0 to 3 month old formula. Now, the formula you use may be up to 6 months, or it may be up to a year. That's still good for a newborn. But I have taken care of patients that shipped over all this expensive formula, brought it into the hospital. We look at it and it's for a toddler. And now they're stuck using regular Enfamil anyway because they don't have the formula they want. So make sure you're checking the labels to know what you've bought and it's the right age for the right age of your child. Okay, so my next question was on Placenta Previa. It said, I'm from Tamil Nadu. I hope I pronounced that right. I am now in my 5th month of pregnancy. My anomaly scan report shows a low margin posterior placenta. What should I do? I love Placenta Previa questions. They are so much fun for me to explain because I think it really gets you in tune with your body and kind of some of what's going on for labor. Okay, so let's start. This is our uterus. And at the bottom of our uterus is our cervix. Okay, so your cervix, it looks and feels kind of like my 2 fingers right here. So it's long and it's thick and it's closed. Okay, this is open, this is closed. And it's funny because if you actually feel a cervix, it kind of floats backwards a little bit, but it feels like about this consistency when you're like early in your pregnancy. Now, when I say closed, well, you guys must realize that it has to open. This is dilation right here, right? So your fingers are a perfect representation because this also shows you how a mucus plug works. So the cervix has to have a little tiny opening that can eventually open up. So this tiny little opening, which is closed, is where the mucus plug lies. So the mucus comes in here and fills up this space so that no bacteria can travel up into your uterus. And then what happens is as you dilate, the mucus plug comes out. So there's your mucus plug. All right, so we're back here. So we have our uterus and we have our cervix. Now, placentas. Placentas are an organ that feeds your baby. And so this side of the placenta is full of all these different blood vessels, and this side of your uterus is all these different blood vessels, and they connect together. And then your umbilical cord comes out and goes to the baby to do the exchange of nutrients, right? So this is where it normally sits. And again, if you have a uterus that's like this, it's kind of up to the side. That's kind of where they sit. Now, you have 2 different terms, anterior and posterior. Anterior means front towards you guys, and posterior means back towards your spine. So when you have an anterior placenta, it's up front towards your belly button. Anterior placentas are kind of interesting because I don't know if you guys have ever gone to the doctor's office and it took them forever to find the baby's heart rate. They're going all around and this and that. You might also have a baby that you don't always feel kicking. Usually, if you ever ask and say, where's my placenta? 9 times out of 10, they'll tell you your placenta's anterior or in the front. And when you have that big placenta in the front, it's like a pillow. So when the baby's kicking, they're kicking the placenta, you're not going to feel their kicks as strongly as if the placenta was in a different position. It also means that if you have a big old placenta in the front, it's hard to find the baby's heart rate because you've got to somehow get your Doppler around that placenta. Okay. So now we're on to placental position. So you have your uterus with your placenta. Okay. So complete placenta previa. Placenta, cervix, totally over it. That is a complete placenta previa. So what this means is that the placenta is still working, still a whole bunch of blood vessels, but it has planted himself right over the cervix. Now, when you have a complete placenta previa like this, you are going to be having an automatic C-section. There is no way around it. It's going to happen. And usually your C-section is planned and is usually early. Because the thing with Braxton Hicks contractions is here's what contractions do. This is your cervix. And what they do is as you have these contractions, it starts to dilate your cervix. Okay. And your cervix does this and it does this. And then you can have a baby. So when we're doing this going from thick to thin, that is effacement. So this is 0% effaced, and 100% effaced is where it's like thin, like a piece of paper, okay? So that's effacement. Dilation is that 0 to 10 centimeters, where this would be 0 and this would be 10, okay? So those are two of the numbers, right? So when you are having those Braxton Hicks contractions, it starts to like pull that cervix apart. Well, if you have your placenta here and you dilate even 1 centimeter, this dilation, now these are open blood vessels. You start bleeding through the vagina, and that can be a medical emergency for you and for baby. So we cannot let your cervix dilate. If you have a complete placenta previa, we need to make sure we prevent that. And the only way to do that is to have a C-section before you ever start contracting. Now, partial placenta previa. This is where part of the placenta is there, okay? In a partial placenta previa, usually you are having a C-section. Low marginal is sitting right next to it, okay? So if it is a low marginal placenta, you usually can have a vaginal birth. They're usually going to monitor you very carefully. They may end up inducing you just so that everything can kind of be controlled. They will oftentimes recommend that you get an epidural. That's the pain medication we put into the spine. This way, if you do need an emergency C-section, you've got your anesthesia in place. But as long as the placenta is low lying here, it can stay out of the way. You can just dilate and have your baby. Now, the other thing is, this person said she's in the 5th month. So one of the things you guys also need to know is when your pregnancy starts, your uterus is super small. And as you get bigger and farther along, the uterus gets bigger. I mean, it has to hold this big giant baby, right? So the uterus, as it gets bigger, your placenta can grow out to the side. So it can start low and go up onto the side. So somebody who has a complete previa in, say, the 3rd month or the 4th month of pregnancy may have not even a low-lying placenta at birth. It can move. That's normal. It's healthy. It's not that it detaches. It stays attached. It's the part of the wall just stretches out away from the cervix. Okay. All right. So how do I get relief from back pain during pregnancy? That is a tough one. So, I am going to say that this is a complicated question and it depends on what is causing the back pain. But the starter, super easy one is actually it's like a back brace. I mean, I guess that's the best way to put it. You can also do abdominal binders, but you don't really want to bind the belly. So if you guys have ever seen, and they sell them like in durable medical equipment, like on Amazon and different things, there are braces that workers use, like warehouse workers, when they're going to lift heavy things. And they go on the lower back, and then they have straps. And the idea is to support the lower back so that when you're lifting, you're not straining the lower back. Well, when you're pregnant, you're holding all of this weight in the front, and that can put a lot of strain on your lower back. Additionally, if you've had more than one pregnancy and you have any diastasis recti, that's basically where your abdominal muscles have kind of split open. It's kind of like a hernia. Your abdomen is weak. It doesn't have any core strength, and therefore all that weight is just pulling forward. With these back braces, what happens is you put them on and they are tight, but they can lift up the weight of the baby and put it up onto the shoulders because of the way that they're designed. This is oftentimes fantastic for reducing pain. It's homeopathic. It's super easy. You can take them off and on. It's not like it's something that you can use as needed. And usually they're very well received by healthcare providers. So that's for starters, what I would tell you to be asking your healthcare provider. Next, you can ask about actually massage, chiropractic treatment, and acupuncture. I believe in all three. They are all extremely effective. But let us be extremely clear. You cannot see an acupuncturist a massage therapist, or a chiropractor that does not have specialized training in treating pregnant women. A pregnant woman has a lot of spots on her body that can trigger labor. So if you believe in Eastern medicine and holistic whole body practices, and I do, then you understand that there are different pressure points and energy spots that, if triggered, can trigger contractions and preterm birth. So you have to have somebody who's laying hands on you that is familiar with how a pregnant body works, the different changes to circulation during the different trimesters, and all of the other elements to make sure that the care you're getting, is very, very holistic, but also it's very safe. Now, that may freak a lot of people out, but actually there's a lot of fantastic providers. You can usually use some of the topical menthol creams, but only in very small amounts. Tylenol is usually safe for pregnancy. And then, of course, you also want to make sure you know what's going on. If the back pain is coming and going, that could actually be contractions. You want to make sure you're talking to your healthcare provider about it. But my big, and a pregnancy pillow for positioning in bed. But my biggest number one is a back brace. So I hope that answered your question. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor. I am here answering your questions live. Please feel free to put your questions into the chat. I am still recovering from COVID. For those of you who might know that I had COVID, I've had it for 3 weeks now. So if I sound weird, that's what's going on. And for any of you guys who were here last week, sorry for the technical issues. All right, so we are going to go on to a preterm birth question, which I think is a great transfer from the placenta previa. So it says, "Hi doctor, I have a history of preterm deliveries. First in my 3rd month, then after 1 year, the second in the 5th month when my water broke, and the third at 26 weeks due to a short cervix. Instead of cerclage, I had a boy who lived for 1 month before I lost him. Now my doctor has advised me to have a Schroeder, cerclage for the next pregnancy, but I'm scared of it and have some questions. Can I conceive again after 2 or 3 months? Is there any treatment for me before pregnancy to prevent preterm birth? Is it necessary to have a cerclage in every pregnancy if it's done once? Do I need complete bed rest in the next pregnancy? Can I treat myself before planning the next pregnancy?" Okay, so this is a fantastic question. And I think it answers, even if you're not having issues with preterm birth, it can kind of relieve some anxiety. And I'm really, really, my heart goes out to you, to this mom who's had so many losses. So one of the causes of preterm birth is an incompetent cervix. And I have a video on that. And it basically means the cervix that we were talking about, it doesn't stay closed. It starts to open up prematurely. There's a lot of reasons why this can happen, one of them being infection. And we have some questions coming up on infection, so I'm going to leave that be for now. So one of the things that we will do if somebody has a history of preterm birth related to incompetent cervix is we will do a cerclage. So a cerclage is stitching the cervix shut. Okay, so this is the cervix, and we literally take surgical sterile needle and sterile thread and we sew it closed. I mean, it looks just like sewing if you didn't know. Now, the Schroeder cerclage is placed higher up. So this is the internal os and the external os. Top is towards your uterus and the bottom is towards the vagina, right? So this particular cerclage is a little bit stronger because it's more towards the top of the cervix, which is why it sometimes is likely to end up being more successful. But there are some more risks with it. And usually you end up having a C-section with this, okay? So some cerclages, you have less of a chance of having a C-section, and some you have more of a chance. There are risks associated with cerclages. For starters, we're going in when you are not considered viable. Okay, that means your baby, if delivered, would be lost, unfortunately. They wouldn't be able to live outside of the uterus. So the thing is that when we go in, there's a risk that we could create an infection. There's a risk that your amniotic sac might, break. And if it breaks that early, the baby's not going to survive. So you have to understand the risks. The additional thing is there can be some damage to your cervix and lead to additional cervical incompetency in future pregnancies if you dilate and you continue to dilate, even though you have a cerclage on. A cerclage does not always prevent the cervix from trying to open. So your body may fight this cerclage. And if it does, it will be fighting against that. One of the ways we know this is you'll start to bleed. So when that happens, we'll cut the stitch, we'll allow the body to do what it needs to do, but that can cause some damage. One of the terms she used was short cervix, as I talked to you guys about before. A cervix is supposed to be long. A short cervix is simply what it sounds like. It's shorter. Okay. And we measure that in centimeters. Now, is it necessary to have a cerclage with every pregnancy? No, it is not. You can have 6 cervical incompetencies, and pregnancy number 7 can be totally fine. Is it likely? Yes. And that's, I think, the better way to put it. You are more likely to need repeat cerclages if you get one the first time. Now, can you conceive again? Absolutely. A lot of providers tell you to have 2 period cycles, and then you can start to try to get pregnant again. That is dependent on your health history. Now, is there anything you can do to help prevent preterm birth? Unfortunately, no. Incompetent cervix is not something, there's no treatment, there's no surgery you can do in between. It's just something that happens to some people. The best thing you can do to prevent any other issues is to make sure you're as healthy as possible during your pregnancy, eating right, exercising, sleeping right, drinking plenty of fluids, that kind of thing. Our bodies try to go into labor if it senses something that isn't good for us, which is why the prevention of infection is key. And I'm going to get to that in a minute. And do I need bed rest? So I have a video on bed rest, guys, and I suggest that you check it out. It used to be back in the day that everybody thought bed rest was like the best thing ever, and it really helped prevent preterm births. What we know now is that that is not always the case. Bed rest can be actually very bad for mom and very bad for mom's health, and therefore very bad for the pregnancy. So it actually can be counterintuitive to having a healthy pregnancy. Now, sometimes the reason why we will have bed rest for a incompetent cervix is because if the head of the baby is pressing down on a cervix that's trying to open, it can actually encourage that more. Okay. So what you want is you want to make sure that you're not putting pressure on the cervix. So sometimes keeping off of that helps. But most of the time, we're not going to recommend bed rest. All right. So now let's go on to some of that infection stuff that I was talking about. So I had 2 different questions that I think would really kind of lead into this. So the first question is, I'm 32 weeks pregnant and I have a feeling I have chlamydia based on symptoms. Is it okay to get treatment if I'm near delivery? The second question is, I'm 27 weeks pregnant and I have a UTI. My doctor prescribed Aspirin 250 milligram tablets. Please advise if they're safe to take during pregnancy. So chlamydia is a sexually transmitted disease, and there are many sexually transmitted diseases that you may experience during pregnancy. I feel like it's very important to talk about this stuff. It's too stigmatized. It's not always somebody's fault if they are exposed to a sexually transmitted disease for a variety of reasons. And so sexually transmitted diseases are one of many infections that can cause preterm birth. Urinary tract infections, which is where that other question comes from, can also cause preterm birth. So when an infection hits your vagina, your uterus, or your bladder, it creates this environment in that area that's kind of toxic for the body. And that toxicity can cause uterine irritability, okay? That uterine irritability can lead to contractions, which can cause the cervix to actually start to dilate, and that leads to incompetent cervix, preterm birth. For a variety of reasons, your body is trying to protect you. Depending on where you are in your pregnancy, if you are pretty much before 20 weeks of pregnancy, your body oftentimes will try to kick you into preterm labor and possibly cause a miscarriage if it senses something that will put you, the mom, in danger. Your body has this way of trying to protect you because you are needed to have babies. So if this pregnancy is going to be a danger to your life, your body is going to try to protect you. And then after about 20 weeks, it's very interesting because oftentimes your body will compensate as much as it can for the baby. It's not always 100%, but you can kind of see that. But ultimately, depending on the complication, your body's going to try to have the baby delivered because most things, if you deliver the baby, you will start to get better. When it comes to infection, that's because as a pregnant woman, you're immunocompromised. So your immune system's not working as well. And so you're more likely to get an infection and get really robust infections. Now, going to the chlamydia question, absolutely. You can get it treated at 32 weeks. You want to get treated at 32 weeks. Untreated chlamydia can actually lead to some severe complications for the baby. In fact, they're so severe that we usually test moms around like 38, 39 weeks for chlamydia again. And we oftentimes test moms when they come into the hospital because it's quick. Treating chlamydia is easy. You get some antibiotics. So definitely get that treated. In the other question, she was asked if she could take Aspirin. Aspirin is an antibiotic called Cipro. Cipro is one of the medications that we don't oftentimes prescribe during pregnancy. It's a kind of risk versus benefit type of thing. It very much is not really well researched or used, so it's hard to say whether it would work. I would definitely be having a discussion to find out why this one was picked versus some other medications that are more commonly used for urinary tract infections during pregnancy. But if you have a treatment resistant version or something like that, then this may be the right version. Now, one of the things I'm going to tell you guys is if you do get treated for any type of infection during your pregnancy, you want to go ahead and make sure that you are using that medication in its entirety. You don't want to just use part of it. If you use part of it, you may start to get symptom relief and then the infection comes back again and it's stronger and harder because you didn't complete the dose. So make sure you take all of your medication as prescribed. So, hi Tess. Do you know if Brevely and naproxen for migraines are safe for pregnancy? So, I never trust my brain entirely, and you guys should be making sure that your healthcare providers are always using the most up-to-date resources whenever they are answering questions like this. For any of you guys who are wondering, some resources that you can use besides your OBGYN midwife is your pharmacist. Local pharmacists do get up-to-date training. Also, somebody like me who has specialized training in pharmacology for pregnant and postpartum women, I have access to resources that we have determined are like these people are people that do this all the time to determine the safety. From what I remember, naproxen is a no-go. And so that is what I'm going to look at. And naproxen is a no-go. Listen, it's not a no-go. It's a risk versus benefit type of thing. But the thing is that it can lead to some blood pressure issues. So they don't want you to use it usually during pregnancy. It also can lead to some bleeding issues. So pretty much you're only allowed to use Tylenol. Now, or Brevely, I have never heard of. And I'm going to guess it is not safe for pregnancy. And I am going to tell you guys. Okay, so the drug guide that I am using is by this fantastic provider. His name is Thomas Hale. Thomas is a pharmacist, actually. And what he has done is he's basically aggregated together all this different information about medication. So molecule size, half-life, fat solubility, studies on animals, any studies there are on people, all this different information, safety profile a medication has for, say, an adult or a child versus, unknown. So he takes this all together and he's created a risk scale. And he also runs the infant risk line. And the infant risk line is something anybody can call. Anybody out there can call and they will talk to you about different medications and stuff. Now, the scale is for pregnancy P1 through P5. P4s and 5s are not safe. These are no-goes. One of P5 would be, for example, cocaine. Completely not safe for pregnancy. Ps 1 and 2 are medications that are generally speaking considered safe. P1 being the most safe. Examples in the P1 category include Unisum, which is part of a medication called Diclegis, which helps with morning sickness. This is safe for first trimester. And then the P3s are right in the middle. It's a risk versus benefit. This particular medication falls into that realm. I will tell you, I would never prescribe this medication personally. And so when you're having a discussion with a healthcare provider, you want to make sure they are very forthcoming and open and honest with you about what's out there for information. This particular medication, there's no data in humans. However, in animal studies, there were adverse effects, including embryo fetal development issues, and embryo fetal death in rabbits. There was also issues of decreased body weight in rats, and these were studies that were done in doses greater than what a human being would receive. However, there are tons of studies on other medications where they'll use many times the highest dose for a human adult, and there's no data to show any type of birth effects in animals. And in this case, that's not the case. So I personally would want to have a really big discussion on risk versus benefit. So, but I wouldn't prescribe it personally. Before I would honestly be looking at diet. There's a lot of, COVID. There's a lot of evidence about food and its impact on migraine headaches. So for a lot of people who don't know, you can actually trigger migraines when you eat high allergen foods if you are prone to migraines and already have a headache. So what's an example of a high allergen food? Bananas, strawberries, chocolate, nuts, any of the nuts. Now, it doesn't mean you have to be allergic to it. So I've had migraines since the 5th grade. I've had them forever and ever and ever. And I now don't need to take any migraine medication because one of the things that I figured out very early on was about food triggers. So when I'm getting a headache, I drink some coffee, I take some Excedrin, but I avoid high allergen foods. So I do not drink any cola syrups. Cola itself is actually a migraine trigger. I don't eat any strawberries, bananas, chocolate. I avoid a lot of dairy. I don't eat nuts because even though I'm not allergic to those things, they're high allergen foods because they are more inflammatory to our body. And by reducing my inflammation, I have less of a chance of getting a migraine. So I say I have migraines. I wake up with a couple bad headaches in the morning, but a bad migraine, like what a lot of people talk about where they're in bed and they can't function, I might have one of those now every 3 months. And that's really due in part to being able to identify and then reduce some of those sensitivities. So speaking about food, I had a kind of comment on my superfoods video. So during my first trimester, I didn't like meat. It makes me sick. The only things I like are hot dogs and bologna, but I quit eating them because they're deli meat. I don't like fish either. So now I'm a bit concerned about my protein consumption. So I think the superfoods video is a great video to highlight nutrition. I also have a video on the keto diet, which I totally encourage you guys to look at. What happens with some of these is the importance of understanding what nutrition looks like and where you can get different things to help your body function well. So protein doesn't just come from meat. It can come from dairy products. It can come from nuts. It can come from oils. And believe it or not, one of the places you can also get protein is actually peas. So a lot of people don't realize, but green peas are actually a pretty good source of protein. There's protein hidden into our breads. So, in our in so you need to look around, but you may have more protein getting into your diet than you realize. The other thing is that we are used to these large portions. And because we're used to large portions, we assume if I'm going to eat a big piece of steak, I must need as much of this area of eggs, which is like what, 6 eggs? So you don't need that. You need to look at the grams of protein that are required per day, and then you try to get those as much as you can. Look at what you like to eat. So pregnant women oftentimes have cravings. We talk about this all the time, right? And I tell women, don't discount the craving. We make fun of the woman who craves pickles, right? But what's the main thing you're getting out of a pickle? It's salt, right? And so maybe the woman's body is electrolyte deficient, and what she really needs is salt, but the pickle tastes good. So she's going to crave pickles. If you look at ice cream is actually a great source of protein and fat. So while we make fun that it's like some crazy craving, it could simply be that the body is actually craving the protein and fat. And I want to tell you that one of the times that we make fun of women is that in the middle of the night, they want ice cream. So in my practice, often I'm in psychiatry now. And one of the things I oftentimes will have people tell me is they wake up in the middle of the night anxious. All of a sudden they're waking up anxious and they don't know what to do about this, right? And one of the things I will ask them is, do you either drink wine or beer before bed, or do you like to eat a late night snack? And if they say yes to the late night snack, I say, is it high in carbs? Carbs are sugar, right? So, alcohol, if anybody didn't know, is also high in sugar. Well, what happens with sugar, guys? So, what happens is about an hour to 2 hours later, maybe three, depending on your metabolism, you get this spike of energy, right? Followed by a crash. And how many of you remember that sugar crash? You're sitting in class, you're exhausted, you're shaky, you're like, right? Well, if you get that sugar crash in the middle of the night, that can be perceived as anxiety, right? You wake up, your heart is racing, you don't feel good, etc. Now, imagine if you're a pregnant woman trying to grow a human being. Well, with my regular adult clients, if they describe this where they're having that late night sugar and they're waking up, I tell them to eat a piece of cheese before bed because cheese is protein. And what happens is sugar is a fast spike and drop in your blood sugar, and protein is a slow burn. And so it can actually prevent these hypoglycemic drops. So this pregnant mom who's waking up in the middle of the night looking for like ice cream, she might actually be wanting to get some protein in her system. And so that's why, again, look at what you're eating. Look and see what calories and protein and fat and stuff you're getting. You may be getting everything you need. Don't just you're not like a cookie cutter, and so it's very important that you individualize your diet for you. And of course, if you're having any complications, always follow what your healthcare provider is telling you. All right, so we had this great question on my thyroid video. So I have gastroparesis and a gastric stimulator implant on my stomach. So gastroparesis is like slowing of the intestine in the stomach. So additionally, I have hypothyroidism and ITP. After experiencing a miscarriage and stillbirth at 34 weeks, I'm nervous for this pregnancy and want it to go smoothly. Are there any suggestions you can give me? I would greatly appreciate it. So, hypothyroidism is low thyroid, and ITP is immune thrombocytopenic purpura, which is an autoimmune disease that causes low platelets. Okay, so let's talk. All right, number one, thyroid, one of the most important things in your entire body. I always debate if somebody asks me the most important like organs, of course, everybody thinks heart and brain, right? Heart and brain. But let me tell you something, the thyroid is right up there. It's definitely probably in the top 3 because the thyroid controls so much of your bodily function. If it is too low, that can cause serious issues. If it is too high, it can cause serious issues. Your thyroid can actually stop your heart if it is really that bad. I mean, it controls heart and breathing and stomach and everything. Okay. So we need to make sure that the thyroid is always working right. And I test thyroid all the time because in psychiatry, high thyroid can cause anxiety, low thyroid can cause depression. So when you are pregnant, it is very common for you to develop thyroid issues. And you can also develop it postpartum. So it's something we kind of keep our eye on. So when you have hypothyroid during pregnancy, you simply need to be having your thyroid levels checked regularly, and you need to make sure you're taking the medication. They can give you a pill, and that works. Now, ITP, which is the autoimmune disease, it basically attacks your platelets. You end up having less platelets. Platelets are a part of your blood that helps your blood clot. So if you cut your finger, you know how it bleeds for a second and it stops bleeding? It stops bleeding because platelets come and basically they seal off the cut, okay? Without enough platelets, you bleed and bleed and bleed. So with ITP, one of the things that can happen is if your platelets are too low, you can actually start to bleed out. If you start to dilate or anything before we can get you delivered fast enough, sorry, you can actually end up where the baby can pass away. So this is why this mom experienced this loss. So is there anything you can do? What you want to do is you want to get connected with a very, very vigilant maternal fetal medicine physician. Maternal fetal medicine physicians are physicians that specialize in high-risk pregnancies. So when anything else goes wrong outside of a normal pregnancy, you should be seeing an MFM. Now, there's also reproductive endocrinologists. Endocrinologists by trade are hormone doctors. So they're the ones that take care of hormones. That includes diabetes, because diabetes is based off of insulin, which is like a hormonal response. You have thyroid, you have adrenal gland issues, etc. So endocrinologists are your bet for any type of hormone issue. I would be telling you have a reproductive endocrinologist. That is a doctor who specializes in endocrinology, hormone stuff for a pregnant person. And I would also be having possibly a hematologist on board. Hematologists are blood doctors. They specialize in dealing with blood dyscrasias, which is another fancy way of saying blood diseases, and they can help to manage the ITP. And then you want close, frequent monitoring. You need to make sure they're doing Doppler studies. For those of you who don't know, if at a certain point, if you're having a really high-risk pregnancy, part of what we'll do on our ultrasounds every week is we'll actually check the blood flow of the placenta and the umbilical cord to see how well everything's flowing to make sure the baby is doing well. So that's one of the things that we can do. And other than that, you just got to follow your healthcare provider's advice. I'm getting towards the end. I've got a couple more questions to go. So I have a question on blood pressure medications. So blood pressure medications, it said, which blood pressure medication is good in early pregnancy? This is a great question. So if you have high blood pressure already and are planning to get pregnant, you cannot just take any blood pressure medication out there. So any woman who's trying to get pregnant, and this is a thing, you need to go to your cardiologist and say, hey, I'm about to get pregnant. Is this medication safe? There's diuretics that we don't use. There's medication called ARBs that we don't use. So you need to have them review your medications. However, there's many medications that are safe, including labetalol, which is a beta blocker, nifedipine, which is a, oh gosh, I forgot what nifedipine, what category nifedipine is in. It's also called Procardia. It's an extremely good one. Calcium channel blocker. There you go. And sometimes they use Aldamet, but it's not very common anymore. But labetalol and Procardia are used all the time. In fact, Procardia at low doses, the instant release version, can actually also stop preterm contractions. So it's sometimes ideal if we have somebody who's got a little bit of pre-existing hypertension as well as some contractions. So those are some of the medications that you can use. Finally, our last question of the night is a question on depression medications. And I thought I would close out with this one because I think it's a really good question. So, what about the studies done on Zoloft causing heart defects in babies? So I am in psychiatry now. I specialize in medicating women who are pregnant and postpartum. And so I have received specialized training from Postpartum Support International in pharmacology, as well as from the university I graduated with, et cetera. And so this is a big hot button topic. So there are no studies that show that Zoloft causes heart defects. So let me just get that out of the way. If there is, I have not heard about it. The studies were actually done on Paxil. So back in the day, Paxil, also known as paroxetine, which is an SSRI, serotonin selective reuptake inhibitor, there was a small study that was done that showed actually some heart defects that were caused when women took it during pregnancy. So Paxil has a black box warning that you cannot prescribe it during pregnancy. I will tell you that it has now been debunked. Pretty much, if you do your research, you're going to find that there are now many meta-analyses that these are basically retrospective looks that go back and look at that study plus other studies. And that has all been ruled out. That study was done very poorly. There were a lot of questions that were left unanswered, and they no longer believe that that's the case. However, nobody wants to have a pregnant woman be a guinea pig, and so we do not prescribe Paxil unless that is a medication that would save a woman's life. If that's the only medication that she's ever been able to use that prevents suicidal thoughts, we're going to give her Paxil, and we're not going to question it. Now, Zoloft is like the number one prescribed medication for pregnant women. It's handed out like candy all the time. There is so much data on the safety and efficacy of Zoloft. It's not even funny. So now, can you guys find somebody somewhere who's had a heart defect using Zoloft? 100% you can. I can guarantee it. In fact, I can guarantee you will find that for every medication out there. And yeah, I would tell you Zoloft is safe for pregnancy. If you look up, 2% of women walking down the street with absolutely no issues can have birth defects and or a miscarriage. Okay, that's just walking down the street as a healthy woman. Birth defects can happen. So if you are on Zoloft and you have a birth defect, that does not mean it was caused by Zoloft. We do a lot of look at data and all this other, like a lot of look at the data related to all these medications in order to determine whether we can prescribe them. There are medications that are a no-go for pregnancy. A great example is lithium. Lithium is one of my favorite medications of all time. It's so effective. It's so good. It's not scary like people have this stigma. But lithium is known to cause a heart defect called Epstein's anomaly. And it's pretty much a very high probability. So we need to get a woman off of lithium prior to pregnancy. And so it's one of those things that we know this from looking at the data. There's no data to say that Zoloft causes this type of issue. And instead, you can find multiple studies that say the opposite. It is also, there's also a lot of evidence to say that untreated anxiety and depression can lead to miscarriage, to preterm birth, to stillbirth, to behavioral issues later on, to physical issues later on with the baby. So not treating your mood disorder can be absolutely devastating to your pregnancy and your baby. So it's very important that we are actively and effectively treating your mood disorder. Okay. Now, there are some other ways to manage mood. Not everybody wants to take an antidepressant or another pharmaceutical when they're pregnant. I get that. So you want to look for a holistic provider who believes in some of the other alternative forms of treating your mood. For example, getting a good therapist on board so that you can be doing talk therapy, using light, using the sun, using your circadian rhythm, making sure your food is good. These are all things that can help your mood and help to treat some of this stuff. And then remember, a lot of the organ development is in the first trimester. So many women opt to go on to medications in the second trimester where they feel like it's a little bit safer. Do I prescribe Zoloft all the time in the first trimester? Yes, I do. Can I see and do I use other alternatives? Absolutely. I try to meet my patients where they're at. But that's the answer to that question. So, for those of you who stuck till the end, thank you so much. I am Dr. Samantha, the maternity mentor. I am so grateful that you guys were here on another Monday live Q&A. We are here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions that you have put in onto our videos. Please remember to like and subscribe to the channel. Subscribing to the channel really, really, really helps me out as a content creator. We're also on Facebook, Instagram, and Twitter. Follow us over there. Please share the channel with your friends and family. Unfortunately, due to a 3-week hiatus for COVID, we do not have any videos coming out this week, but I still encourage you to subscribe, hit the notification bell, so when we do have content coming out, you will be notified. We will be filming this weekend, and so we will have content coming back out in the next couple weeks. For those of you who are here in the US, we have Memorial Day coming up. My plan is to be here live, but just keep coming back if you can. Thank you so much. Thank you so much for all of your support. I am Dr. Samantha, the maternity mentor. Bye for now.